Hello and welcome back to Repro Youth Connect. When you see us, you know there is good content, there is education, there's much to learn about health. So my name is Sheila Nailantei na leo nimekuja na mazuri. Leo we're going to discuss a lot about uncomfortable topics, zile vitu hamtaki kudiscuss. Today we are discussing them because we want you to know more about yourself. We want you to know more about health issues. And yes, as you can see, I'm not alone. I am with a friend and I'll give them the honors of introducing herself. Karibu sana.
Asante sana.
Yes.
Mimi kwa majina naitwa Ruth Wanjiru. Mwanafunzi wa katika chuo ya medical.
Yes.
I'm a medical student, and I have a passion. I'm passionate about sexual and reproductive health. And napenda kuongelesha the youth because generally they are the future. Yes, and I think I have a strong interest in provide like evidence-based like education and trying to advocate for like access to like youth-friendly health services to the adolescents.
Yeah. Thank you so much for that, Ruth, and you're most welcome here. Would like to hear a lot from you. And you see, we understood the assignment. Tunaelewana, sindio? Because we brought one of us, someone who, as you can look at her, as you can see her rather, you realize she's someone around our age. So anaelewa zile vitu tunaenda kudiscuss leo. So into our topic today, we're going to discuss about sexually transmitted infections and more. But before we move before we go deep into the discussion, I'd like us to maybe just give a brief definition of this, which are these sexually transmitted infections. Hizi ni vitu tunasikianga, gonorrhea, kaswende, kisonono, all those things. We're going to discuss about them today. So if you don't, however you'd like, give us a brief definition of that here.
So STIs basically venye tu inasema tu kwa the definition by itself, sexually transmitted infections.
Yeah.
This inamaanisha that kutransmitiwa ni kutoka from one person to another by person through sexual contact. Hiyo ni kupatana kwa njia ya kimwili, na pia through person to person contact kama skin to skin contact. Na pia you can also transmit STIs through mother to child transmission. So those are the most common like transmission methods. Alafu when you say the common some of the common STIs zenye tuko nazo ni sasa zenye kama umemention kama gonorrhea, which is also known as kisonono in Kiswahili. Kuna syphilis, also known as kaswende. Kuna chlamydia, kuna trichomonas, kuna HPV, kuna HSV. Yeah, they are like a spectrum. Sasa ni kuna zenye zinakusiwa by bacteria, parasites na viruses. Yeah.
Okay. So basically kisonono ni nini?
Kisonono, it's a bacterial infection, gonorrhea.
Oh. Yes.
So basically, you know, like most of these infections mostly like ziko na almost the kind of the same like presentation. I wouldn't want to go like deep into it so that nisi confuse watu. But generally, what I can say is they present like kind of differently but kidogo sana, but mostly like it's a broad spectrum, so some of these symptoms are like are common among them. Yes.
All right. Okay, so now you have a bit of the definition of what kisonono and kaswende. Yeah, I'm mentioning these terms because I realize nowadays these are things people joke about, and because conversations about sex have been very casual nowadays. True. Anyone and everyone is discussing them, and we see them everywhere, in movies, in games, everywhere. Kuna sexual intercourse. That means we are encountering these sexual conversations almost now and then, even in jokes. So I'm going to read out a few numbers that are concerned with UTIs and these sexually transmitted diseases and infections. Okay. And I realized that annually in Kenya, that means in every year, kuna almost around 300,000 people who are being reported, or rather who are reporting to hospitals and healthcare facilities with cases of sexually transmitted diseases. around 300,000.
Yeah.
I think that's a very high number. And in this case, you realize that on a daily basis, if it's 300,000 per se, it is almost 800 people per day.
Yeah.
The whole of Kenya and only Kenya. We cannot start to talk about the global or maybe the like continental reports.
Yeah.
But because I mean, if 800 people are reporting cases of infections, sexually transmitted infections every day, it means it's a conversation lazima tukwe nayo. So probably you're listening to us and you're hearing this and you have experienced it, or someone next to you has experienced this. This is the conversation you have to listen to today. You may need to listen to so that you know if it happens to you or if it is already happening to you, what are you going to do about it? So as we have defined, tumeanza na definition, I'd like to just ask probably how are these, before we discuss about now going deep into transmission, how do you know you have these diseases? Utajuaje uko na gonorrhea ama syphilis ama how does it look? What do people experience so that you know that this is what I'm dealing with?
Okay.
Yeah.
I think nitaanza kwanza kusema so for STIs, like you have to have the exposure first to like sex, and I think kuna like a difference between like UTIs and STIs.
Okay.
So so for STIs you have like to have that sexual like encounter, sawa. And then after this maybe you unaona kwa mwili yako umeanza kupata like changes. Some of these things zinaweza kuwa zinafanana na UTIs, but if you had like a sexual encounter, you should have like a big question like if it can if it is an STI, sawa. So some of these symptoms zenye ziko ni kama maybe ukipitisha mkojo unasikia uchungu, kama wakati wa kupatana kwa mwili na your partner unasikia uchungu,
like sexual
intercourse unapata uchungu, kama discharge umeanza kusikia like imeanza kunuka ama imebadilisha rangi. Pia kuna unaweza pata maybe uko na other symptoms kwa mwili tu, unasikia fever, unasikia mwili umechoka. Yes, also unaweza kuna zenye ziko specific kama kuna zenye zina produce like warts kwa mwili like especially around the genital area. Warts ni kama uvimbe hivi zinajitokeza like alafu ziko na kama cauliflower like haiko ina regular like lesion around the genital area. HSV which is herpes simplex ina produce kama vitu kama blisters, ulcers. So that's some of the signs and symptoms that you see in someone mwenye ako na STIs.
So if you realize a lot of the things she has said are not so uncommon, utarealize uko na rashes uko chini, utarealize probably unajikuna more often than probably you'd expect to be, or vile amesema pia when you're going to susu or when you're going to the toilet, utarealize you're feeling a bit of pain kupass urine, so that could mean that you are you are experiencing these infections. You could have been infected, or you could be having the beginning symptoms of these diseases. Okay, so because now we have discussed about how they would look, how yani mtu anaweza kuwa amepata aje, because now that we're talking about sexually transmitted infections and diseases, someone would easily assume that it is only through sex. Ama if it is actually only through sex, could you kindly confirm to us that uki have sex ndio utapata? Is it possible that a virgin apate UTI ama easy infections, so tell us about it.
So for sexual it's still but back to the definition, sexually transmitted. So maybe mtu mwenye like a virgin, you can get like a UTI which is different from an STI. Yes. So like STI has to have like that sexual contact. So it's either through vaginal penetration, either anal, even oral, or oral sexual encounters. You can also have mother to child, ile yenye kama mama hajajua akona an STI, anaweza pitisha pia kwa mtoto. Yes. So those are some of the things that you get. You can get an STI. A UTI, it's basically like an infection in the urinary tract. So ina unapata like nini kama bacterials mostly ni bacteria ina cause the UTIs through uchafu, like maybe imetoka upande wa choo. You get it through maybe most of the times ni through hygienic like practices, yenye unapata like mtu ana wipe from back to front, so bacteria inaenda ina form hapo, ina colonize hapo kwa the urethra ama alafu sasa inapanda through the urinary tract, sasa inaweza panda nifike kwa kidney. But for sexually transmitted mostly almost like always presents in the reproductive organs.
Okay.
Yes.
Okay. So just to echo what she has said, amesema kwanza hiyo story ya kuwipe, ladies, we have to talk about this. When you go to the washroom, you need to wipe to wipe from the front to the back, right? When you wipe from the back to the front, there are high chances you're transferring bacteria from the back part, that is from the anal structure, to the front part. And that could potentially cause UTI. Yes, and also through sexual intercourse. Is there any other way that someone could get these diseases?
I think that's basically it, because
The main ones.
and I think the mainstay kabisa I will try to insist on kabisa UTIs are very very different from STIs.
Yeah.
But kind of zina present almost in a similar manner.
Yeah.
Yes, but
Okay.
like the way kuna those predisposing factors for STIs that are different from a UTI. Yes.
Yeah, so by now we know what causes UTIs, what causes STIs also, and probably it's obvious what you should do. Wipe from the front to the back, not from the back to the front. But maybe you could tell us a bit more of how to be preventive, or rather how to prevent ourselves from actually getting these diseases. Are there preventive measures? Is drinking water in any way helping or something of the sort? So yeah.
Okay, let me focus on the STIs. So for the STIs, this like some of the things that you can do to prevent yourself from getting STIs.
Yeah.
Most of the times, we first with the first one, abstinence. It's the sexual encounter yenye could predispose to this, but that's not practical in every setting.
Yeah.
So the other thing you can do is not contraceptives, condoms.
Okay.
And consistent use of condoms. Correct and consistent use of condoms, because when you don't like use it the correct way, utapata like uko predisposed to getting an STI. Some of the other things that you can do to prevent this, it's okay, like HIV is also like one of the STIs. So for someone mwenye anaona like ako exposed to such, you can have the PrEP, you can have the PEP, so that you can prevent you getting the infection.
Okay.
Yes.
All right. So in that case, does that mean that people who have underlying, should I call them diseases, are more prone or are more exposed to these UTIs and STIs? For example, mtu anadeal na diabetes, HIV, things that are consistently being treated, or even cancer. So are they more likely to get these diseases than someone else?
Yes, definitely, because you know, like your body, if already in a fight like a disease, your immunity, like if you introduce now another pathogen, like another virus or another infection, your body like itakuwa sasa inangangana like to fight like now these two things. So definitely mtu mwenye hajakuwa na any infection before that atakuwa like na a better chance of like fighting the disease than this other person. But that doesn't mean that ati sasa mtu mwenye hana any predisposing like disease asisik help ati because understand a better chance. No. Different people have different immune responses. Yes.
Okay. Just before I go to the next maybe new question, I'd like to inquire more on, Ulkome mentioned something to do with condoms, and you said that correct use of condoms, and probably this is not something everyone wants to describe or something of the sort, and we realize that most people are having sexual intercourse right now, and in our previous episode, go watch it, we've talked more about condoms, and we realized it's one of the safest, I don't call it family planning methods. It's not a contraceptive, right? Use of condoms, it's separate.
I think it isn't basically.
it's not so use of condom, see contraceptive, see part of contraceptive, but it's part of family planning.
Yeah, it's part of it's part of family planning, but it's not like a contraceptive.
So what do you think contributes to the high prevalence of these infections and diseases?
Okay, kuna several factors. Okay, kuna some of them are, like one of them that's biologically kama like cervical immaturity kwa wasichana wadogo. Alafu sasa the other general ones you can have the poor access to these services, inconsistent condom use or protection methods. Pia kuna multiple sex partners, kuna some people that start doing sexual intercourse at a very young age. Pia kuna social and cultural factors that affect this, kama unapata like in a society, in a particular community, unapata like kuna those child marriages, such factors.
Okay. Yes. All right. Probably towards the end, as we wind up, we can discuss about maybe the possible outcomes. For example, if this goes untreated, if you don't pay attention to it, or if you treat it wrongly, what is the possible outcome? As you also talk about maybe where to get help. If you're already in it right now, if you experience it in the future, where should you get help from?
Some of the complications that arise from not treating these STIs or treating them wrongly, there's some cases that progress to infertility. Mtu ameshapata akishakuwa mkubwa hata yenye anataka kupata sasa watoto hawezi pata watoto because sasa hiyo infection like end up to the reproductive organs, alafu kukakuwa na lot of like scarring na nini, so complications, so hawezi pata mtoto. So that is one of the complications. The other complications to like specific things kama syphilis. Syphilis sometimes ikiendelea progress iko na stages. Ikishafika to like among the last stages hapo, unapata inaanza ku affect the central nervous system. Hii sasa ni like ubongo sasa na the spinal cord. Unaweza pata hata mtu amekuwa paralyzed, amekuwa na dementia, akona weakness kwa mwili. Yes, those are some of the things. Na kama to be specific, kama the most common one in the complication ya HPV ni cervical cancer. Na that is unaona like wanawake wengi in their 40s and 50s wana suffer from this cervical cancer because they were exposed to HPV when they were younger. So those are some of the complications. And where to get help, I think it's very important to use the resources that ziko karibu na sisi. Na I think in every particular like around your community kuna community health workers. Those are the first like people you can access to. If sometimes youth tunapata like ngumu ku approach like a person ama a parent ama like a sibling ati una confide in, unamwambia like hivi naona hivi. So if you feel afraid, you can try to get in communication with the community health workers, and they will direct you in the proper channels to get help from.
Okay. Well. I think before we conclude this video today, maybe you can give your final remarks, as I also give mine, so that we now wrap up. Yes.
I think to finish, I think I would naweza taka kuhamasisha like the youth. When you get these symptoms, ukiona like any change in your body that is change like a deviation from the normal, try and get some help. Try and go and especially go to the medical facilities. Usiende over the counter, because as I said, STIs iko na different causes. Kuna bacterial, kuna viruses na kuna parasites. Unaweza unaendea antibiotics and then uko na like a virus, alafu inaendelea ku progress. The disease inaendelea ku progress. So try as much as possible to go to the a medical facility where you will get the appropriate tests done and get proper medication.
Okay. Yes. Thank you so much for that. Yes, according to the statistics zenye tulikuwa tumepeana from the beginning, you realize that almost 1 in every 15 people are getting these diseases. So it could be you, your sister, or even your brother, anyone that are getting these infections. You need to be cautious. You realize that these things can cause you to lose, it can affect your brain, it can affect your fertility, it can affect a lot of things about you. So it is high time you are aware of this. Share this video to people who can learn from it. And thank you so much for joining us today. I have been your host, Sheila Nailantei, and this is Repro Youth Connect. Have a good day.